Hello everyone, today we are going to talk about bisphosphonates. First of all, I will tell you common drugs which are included in bisphosphonates group. That includes very well known alendronate, and then we have chlordronate, alendronate, and residronate. So remember, these options are common oral bisphosphonates. And if I tell you about common IV formulations or common IV drugs, that includes Zoledronic acid, and Pamidronate. So these two are IV. Okay. Then we will discuss the mechanism of action. So here is the mechanism. Mechanism is very simple, that it inhibits osteoclast activity, and as a result there will be inhibition of bone resorption, right? So here is bisphosphonate. It goes inside the cell, that is osteoclast. Osteoclasts are actually bone resorpting or bone dissolving cells. As a result, bone mass density reduces and risk of fracture increases. All right, so this was the mechanism of action of bisphosphonates. Then we will see a couple of indications of bisphosphonates. That includes Paget's disease, osteoporosis. Remember, osteoporosis is of two types. Number one is post menopausal, and the other one is corticosteroid induced, and the third one is hypercalcemia. But hypercalcemia of malignancy. Say for example, if a patient is suffering from bone metastasis, or you can say resorptive bone metastasis, then it can be declared as hypercalcemia of malignancy. Well, if we talk about the contraindications, then that is hypocalcemia. Hypocalcemia means low calcium level in blood. All right, and there are some specific considerations that should be considered before starting the treatment, and that we will discuss with the help of this image. So specific considerations. Number one is osteonecrosis of jaw, and mainly lower jaw. So in this picture you can see this area, that is the part of lower jaw, and it's almost all right. But after starting treatment with bisphosphonates, this place has been gone through necrosis, and this site is damaged. This site looks resorptive, dissolved. Why? Just because of the effect of bisphosphonates. So for this purpose, if patient needs to undergo any dental surgery or any assessment, dental assessment, then these two should be done before starting treatment with bisphosphonates, right? Bisphosphonates. And this side effect, osteonecrosis of jaw, is most probably because of the IV formulations. That includes zoledronic acid and the other is Pamidronate. But risk with zoledronic acid is more as compared to Pamidronate. There is another specific consideration, that is renal impairment. As you know that bisphosphonates are actually excreted via kidneys and via kidneys in uncharged form. So that's why renal impairment is one of the risks if you're using bisphosphonates. So in case of severe renal impairment, bisphosphonates are considered as contraindicated. And in case of, you can say, moderate renal impairment, if patient is receiving IV formulations, then infusion rate should be reduced. Okay. There is another important consideration, that is of pregnancy. Well, in pregnancy we have to divide all the drugs including bisphosphonates into two groups. Number one, having the category B2 and the other one carrying the category B3. In B2 we have just one name, that is Teludronate. And in B3 we have couple of names, that includes Alendronate, very well known and very commonly used bisphosphonate, then chlordronate, Risedronate, another very well known name, and Zoledronic acid, the IV formulation. Okay, this is IV and all others are oral. What about side effects? are adverse effects? Well, we will divide adverse effects into two classes on the basis of routes of administration. If we talk about the adverse effects of oral, it includes nausea, vomiting, diarrhea, means gastrointestinal side effects. It also includes musculoskeletal pain and headache. These are the common side effects of oral formulations. What about uncommon or infrequent? Those are also important. I will tell you why. It includes esophageal ulcers, esophagitis, okay, and rash. So these are infrequent, not very common, but important to keep these in mind because these are mostly caused by alendronate, especially esophageal ulcers and esophagitis. Alendronate. And if we talk about the side effects caused by the IV formulations, that includes Pamidronate and Zoledronic acid, then it includes flu-like syndrome, fever, hypocalcemia. Hypocalcemia means low calcium level. That's why hypocalcemia is one of the contraindications of bisphosphonates, and it also can cause hypertension, and it can also cause hypotension as well. Well, this is strange, but this is rare. Okay, and another rare event is syncope, means circulatory collapse, and these are common adverse effects. And if we talk about the individual aspects means, if we talk about Atidronate, Alendronate specifically, about means just pulling them out of the bisphosphonate group and talking about their individuality, then Atidronate and Alendronate are both of high importance, and both are in oral formulations. So if we take the usual dose of Alendronate, it can cause osteomalacia. Osteomalacia is a disease in which calcium level goes down and risk of fracture increases. Okay, this is a thing linked with Atidronate. There is another important drug, that is Alendronate. It increases, as I have told you before, that it increases risk of esophageal adverse effect, that includes esophagitis and esophageal ulcers. So increased risk of esophageal adverse effects. All right, and I have told you about routes of administration before. Now I will tell you another reason, one of the reason that why IV formulations are more effective than oral. There's one straight thing, that it goes directly into the blood circulation and high bioavailability and everything. But there is another related reason that per oral formulation, specifically of the bisphosphonate, has low oral bioavailability, okay, and it further reduces with food and drinks. So that's why bisphosphonates should be taken empty stomach, okay, taken empty stomach in order to increase the absorption. There will be one point we will discuss that in detail in the later on this video, but I will just tell you about that. Some of the patients need calcium and vitamin D during the treatment, okay. So if the patient is given with calcium and vitamin D supplements, then these should be taken at different time as that of bisphosphonates, okay, at different time. Why? Because if patient takes calcium and vitamin D with any of the oral medicine, then it will lead to the reduced absorption of the drug, and hence it will reduce the effectiveness or the efficacy of bisphosphonate that is taken orally, right? But there is one drink that can be used as a diluent, that is water. So with water, absorption is not affected. After that, we will discuss a couple of features are the use of bisphosphonates into its indications, that includes postmenopausal osteoporosis, Paget's disease, hypercalcemia of malignancy, etc., etc. So let's start with postmenopausal osteoporosis. So in this case, alendronate is more effective than alendronate. All right, this is the individual comparison from bisphosphonates, that is in comparison of alendronate with etodronate. So alendronate is more effective as compared to alendronate. If we talk about Paget's disease, then and talk about alendronate, the treatment of alendronate should be continued for 6 months, and still biochemical markers cannot be improved, okay. Biochemical markers means tests which are important to be conducted if patient is suffering from the Paget's disease are not settled even after using alendronate for 6 months, okay. And if we talk about the residronate, then it has shorter duration of therapy, and still it has long lasting remission as compared to alendronate. And if we talk about alendronate, then it is the best drug to improve biochemical markers. And this is the reason Alendronate is no more in use. Why? Because we have Alendronate available, Risedronate available, Zoledronic acid that is also available. Zoledronic acid, Pamidronate means those which are available in the IV formulations are actually used for the severe cases. After that, we have to discuss hypercalcemia of malignancy. But let me write the point regarding Pamidronate that is available in IV formulation and it's used in severe cases where oral options are very poor to show the effectiveness, are proved to be very poor regarding the effectiveness. What about hypercalcemia of malignancy? Well, as I have told you that there are certain conditions, certain malignant conditions. Malignant conditions mean certain types of cancers in which there will be osteolytic or resorptive activity. So one of the condition is osteolytic or resorptive osteolytic bone metastasis. In this indication, calcium level is high. Why? Because osteolytic activity is going on, so calcium is going to be released into the bloodstream. So in such cases, IV formulations are used, IV formulations that includes Pamidronate and Zoledronic acid. And there is just one per oral option, and that is Clodronate. So Clodronate is the only per oral option available to treat osteolytic bone metastasis or hypercalcemia of malignancy. What about counseling points? Well, as I have told you before, that if patient is having some dental procedures to undergo or having some dental assessment pending, then these should be done before starting treatment with bisphosphonates. Otherwise, what will happen? Yes, osteonecrosis of jaw. Okay, and there is another counseling point that is related to the absorption, that oral formulations show less absorption if taken with food or drink except water. And what about practice points? Well, you can give patient with calcium supplements and vitamin D supplements if patient is suffering from Paget's disease or osteoporosis. Okay, but again, you have to advise that calcium supplements and vitamin D supplements should be taken at different times, at different time than that of the bisphosphonates. And another point that is regarding hypercalcemia. Hypercalcemia. Treatment should be started immediately. Why? The reason is that it will take 2 to 4 days for treatment. Okay, and along with the treatment, you have to give NS before, during, and after treatment for rehydration. So this was all about bisphosphonates. We will discuss about the individual drugs later on.